There are a number of people out there that have low blood pressure, right? People that get dizzy when they stand up, people that are feeling chronically fatigued. And in some cases, not all, those groups can actually benefit from increasing their sodium intake. Why? Well, because of the osmolarity of blood that we talked about before, where if you have a certain concentration of sodium, meaning sufficient sodium in your bloodstream, that will tend to draw water into the bloodstream. And essentially the pipes that are your capillaries, arteries, and veins will be full. The blood pressure will get up to your head. Whereas some people, their blood pressure is low because the osmolarity of their blood is low. And that can have a number of downstream consequences. It's to know your blood pressure and to address whether or not an increase in sodium intake would actually benefit your blood pressure in a way that could relieve some of the dizziness and other symptoms of things like orthostatic disorders. Let's look at what the current recommendations are for people that suffer from orthostatic disorders like orthostatic hypo, meaning too low tension, orthostatic hypotension, postural tachycardia syndrome, sometimes referred to as POTS, P-O-T-S, or idiopathic orthostatic tachycardia and syncope. Those groups are often told to increase their salt intake in order to combat their symptoms. The American Society of Hypertension recommends anywhere from 6,000 to 10,000. These are very high levels. So this is 6 grams to 10 grams of salt per day, keeping in mind, again, that salt is not the same as sodium. So that equates to about 2,400 to 4,000 milligrams of sodium per day. I point out this paper and I point out these higher salt recommendations to emphasize again that context is vital, right? That people with high blood pressure are going to need certain amounts of salt intake. People with lower blood pressure are going to need higher amounts of salt. And for most people out there, you're going to need to evaluate how much salt intake is going to allow your brain and body to function optimally. So if you're exercising a lot, if you're in a particular cold, dry environment or a particular hot environment, you ought to be ingesting sufficient amounts of salt and fluid.